What is up, everyone? Welcome again to Move Better Now. This is Torso A to P. That means we're going to be side bending on this one. So we're going to start on a comfortable surface. You can use your bed, or if you got a massage therapy table like this one or a bench, go for it. Just lay on your back in a comfortable position and let the body just slide to the right. And you can see how I'm just sliding the shoulders and almost like I'm reaching down towards my right foot. As I'm doing this, it's comfortable. I'm not forcing anything. It's smooth. And I'm only going to go through that around 8 times on each side. I'm going to go to the left side now and repeat the same idea. Not forcing anything. It's all smooth. You may notice that it's tough to slide your neck with your body, or that you'll want to shrug or bring a leg out to the side, and that's perfectly normal. Just note what's happening, because the whole point of this is finding a place that is safe, comfortable, but yet challenging. And that's what we're going to build an exercise later. So I want you to take note of what is difficult, but also what feels safe. In this part, I'm just hiking my hip towards my rib cage. Can I easily take that hip towards the ribs, or do I feel like I want to arch? And you can see this better in this shot where I take that right hip towards my rib and then I let it go. Hip towards the rib and let it go. And I'm seeing if there's any similarities between, is it difficult for me to side bend to my right and hip hike right? Or is it difficult for me to side bend left and hip hike left? Or is it the opposite? Because that can happen sometimes. And this may completely change when you're on your stomach. And again, this process is primarily here so that you can actually feel what's going on. Most people take this for granted. They just go through a bunch of repetitions and never experience what part of their body is actually working. So we want to bring those together, because when you find out what part of your body is actually working, or you feel what's actually working, you can start making really positive changes in what feels good rather than just what feels painful. So I flipped over here and I'm sliding to my left and then bringing myself back to the middle. I am basically putting my hands in a relaxed position so I can tell whether or not I'm rotating, because that can happen often. I like my head over the edge of something so I don't have to lift my head up so high when I do this. And then I'm going to repeat this on the opposite side, where I slide to my right and back to the middle. And you can go as fast as I'm going if you feel comfortable. If you need to slow it down, that's perfectly fine. Because what we're doing here, again, looking for positions that feel safe, but that are challenging. And it should all be pretty not painful. It should all feel good, right? So now I'm going to do the hip hike on the right side and the left side as well, just inverting what I did before. And it doesn't take a whole lot of motion in order to hip hike. So when you see this shot from the feet, you're going to see the pelvis go towards the rib cage again as I'm hip hiking on the left side, and then I'm bringing it down, and then hip hiking that left side and bringing it down. And I do a little bit of an arch here rather than a hip hike, so you can tell that I have trouble when I'm on my stomach and I hip hike. So that would be a very good position for me to start my exercise after I'm done with this range of motion or this exploration. So I'm looking for is something that's tough, but something that feels safe, so that I can build my exercise to get better at that position so my body feels safer when I practice it. So after I'm done with both sides of the hip hiking, I'm going to set up my exercise. And I do this on the floor next to a wall. And I make it really, really simple. If I had trouble when I'm on my back going to a direction, whether it's hip hiking or side bending, this is my setup. I bring both legs over to a wall together, and then I can have the same idea when I am set up with a side bend if I feel safe doing so. If I had trouble when I'm on my stomach, I just do the same thing, but for my stomach, especially with that hip hike. If it was a hip hike problem, I just bring my lower body over. If I had trouble with side bending and hip hiking, then I go into that side bend and bring the legs over. So I'm going to split screen this so you can see this in real time and you can work this together. And I'm going to gradually add some of that side bending in with this so that you have a really good idea of how this all fits. So I bring both legs over to the wall, and again, choose the position that works, and we're going to push into the wall at around 30%, and you're going to hold it for around 8 seconds. Where we push it around 30%, hold it for 8 seconds. And you can add a little bit of that side bend if you want, making sure that you feel connected rather than pushing as hard as you can. Now from here, you're going to relax for right around the same amount of time that you actually pushed for. So I'm going to relax for about 8 seconds or so, and then I'm going to dial it back into the wall and push again. This time I'm going to push a little bit harder. I'm going to push for around 60% for around 10 seconds. I keep that hold, I keep pushing, and then I relax. Now I relax for the same amount of time that I actually went for, so that I'm fully refreshed for my next rep, which is coming up right now. So now we're going to push with a little more effort. I'm going to be right around that 70 to 80% range, maybe all the way up to 90% push, and I'm adding my side bend in with this, and that's going to last for around 10 to 20 seconds. You can go all the way up to about 24 to 30 seconds if you feel okay with that. And the whole point of this is that it's a progressive set of pushes. I want you to feel safe with it. I want you to feel that every repetition that you do or every hold that you do, you notice that you're getting stronger and more capable of handling these positions. And that's exactly why I have this prolonged position here, is because I feel way better when I do it. Now in review, the first set is around 30% ability, and you're going to go for 8 seconds work and between 8 and 10 seconds rest to make sure that you're refreshed for the second set, which is around 60% of your ability, and we're around 15 seconds work to 15 seconds rest. And then the third set are up to 90% ability, 20 seconds work, and then 2 minutes rest before you do any other positions. Remember, this is all about practicing positions that help you feel better. You know that they help you feel better because you feel better. And you want to stay fresh and recover so you can practice fresh and progress rather than beating yourself up. If you're feeling better from Move Better Now, then Body Explorations is a great fit for you. 60 different routines so you find freedom and relief in your body now. Great structure so you always know what you're doing. And if you're like me, I need zero equipment so I can just do it in an empty room, and I always know what I'm doing because it's easy and I feel better. And that's the bottom line, feeling better. Because remember, body activation, you're always one exercise away. Until next time, everyone, I'll see you in the next video.